Hello, good morning and a happy new year to you all from sunny Spain. Excepting it's really not sunny today, it's raining again, and we had rain all over Christmas, which is the first time in the 8 years we've been here it was a washout this Christmas. It spoilt a lot of people's enjoyment where normally we have blue sky and sunshine, but not this year. It was wet, wet, wet. And what I thought I'd talk about today a little bit was the health service here in Spain. And we all get a SIP card, which is credit card size, and it contains all of your information for your pharmacist and if you go to the hospital. So you always keep it with you, and you have to produce it whenever you either go to the pharmacy for prescription or you go to the hospital for any appointments. So that's the first thing you need to know about getting a SIP card, becoming a resident here and a taxpayer. And then from the health service point of view, the hospitals, our experience of the treatment in the hospitals is generally really, really good. But what does happen in the hospitals here, which is different from the UK, is that the nurses provide all the nursing care and they leave all the other care, which is like feeding and spending time with people during the day, they leave that to the family. They do have staff, obviously, in the canteen who cook and prepare the food, and they bring it into your bedside. And typically, you will be in a private room with your own private lavatory. So they will bring the food into your bedroom and leave it. They will not necessarily leave it within reach of you, and they certainly won't feed you. This is where your family comes in. So you need to be aware of that, and you need to either make sure you've got a family member who can be with you, or alternatively, if you are on your own, you need to have some contact numbers for social services or some other carer who could take responsibility for taking those duties on for you. So that's something that you do need to know. When I had my new knee, which was just over a year ago now, they didn't send me to the general hospital here, they sent me to a private hospital for the sake of speed, I think, to get the thing done. And the service levels there were the same in terms of food was brought to my room, but I wasn't fed. I had to rely on Linda to do that for me, and for Linda to be with me, bring any change of clothes and so on and so forth. But the nursing care was excellent. They make sure that you have any necessary painkillers and antibiotics, whatever else you might need. So that's our experience here. You do need to be aware of it, and particularly if you're on your own, try and make sure that you've got somebody in reserve who you can call on, and make sure that you do know enough Spanish to be able to tell them about your problem. I mean, use Google Translate so that you can have something printed out, or maybe better still, if you go to an appointment to see your doctor or to see a consultant at the hospital, take a translator with you so that you can actually understand everything that is said to you, and you can get the consultant and the doctor to understand what you need to tell them. So that's the Spanish health system. We found it to be excellent. It's just different from the UK, and I thought you might need to be aware of that. So there you are, there's your information. I wish you well, and I hope you rarely, if ever, have to go to hospital over here. I hope you have a long, healthy and happy life, especially if you come to live on the Costa Blanca, a Mediterranean diet and loads of sunshine. Thanks for now. Subscribe, it's free. Follow me. Don't miss any of these important bulletins on 30 in Spain. And also, keep your eye on the website, Quick Gift Guide. If you need inspiration, that's where you'll find it. If you've drawn a blank for somebody who needs a gift, Quick Gift Guide, that's where to look on the internet. So, bye for now.